If you talk to a scientist, you might think that they can't give you a straight answer. For example, it's very unlikely that if you ask a scientist, "Is this drug safe?" you'll get a simple "yes." It'll probably be accompanied by some qualifying statements. And although this might irritate you, there are many good reasons for it. The first reason we might seem to make things complicated is that truths aren't always universal. What we mean by that is that some things may be true under some circumstances, but not under others. For example, is it a good idea to keep ourselves fit and to do exercise? Well, yes, except if you're sick and need a period of rest, it might be better to avoid the exercise for a while. Returning to our original example, is it safe to take a drug? Well, perhaps it is, but maybe it's not safe for all patients. So when scientists talk about their work, and it's not presented as simply as you might like, it's not that we're being awkward, it's probably that we're trying to be accurate. The second factor leading scientists to appear complicated is the idea that the absence of evidence is not the same as evidence of absence. This rather complicated sentence basically says that even if you can't detect something, it may still be there. For example, before the invention of the microscope, we couldn't see bacteria. These are generally really small, about a thousandth of a millimeter in size. Now, it didn't mean that they weren't there before we had a microscope, rather we just lacked the right equipment to see them. We refer to this idea as sensitivity. It's a reflection of our ability to measure something that's really there. A related term called specificity is sometimes also used, and this refers to our ability to conclude correctly that something's absent when it really isn't present. Do you remember the question from earlier about whether a drug is safe or not? Well, we only truly know if a drug is safe by giving it to patients. Suppose we test the drug in 1,000 patients and find that there are no problems. Does this mean the drug is safe? What if it caused severe problems, such as a heart attack, in 1 in 10,000 patients, and so no problems were found when we tested it in 1,000 patients? Do you still think it's safe? So how many patients would you have to test the drug in to prove with absolute certainty the drug is always safe? The answer is we can never do that. The next reason science might seem complicated is the idea of false positives and false negatives. When we measure something, scientists are well aware that they can sometimes get it wrong. For example, John might go to see his doctor to be tested for diabetes. If he really does not have diabetes, but the test is wrong and indicates that he does have diabetes, we'd call that a false positive. The test was false in saying that he had tested positive for diabetes. On the other hand, if he really does have diabetes, but the test was wrong and this time it said that he does not have diabetes, we call that a false negative. The test was false in saying that he had tested negative for diabetes. When scientists design tests, they have to worry about how often false positive and false negatives occur. If they are too frequent, the results of the test may not be trustworthy. This makes us cautious about interpreting results. Another reason scientists might appear to make things complicated is that very often we like to look at the primary data rather than taking people's word for things. For example, recently in the UK, the law was changed to allow fathers to take time off work when their child was born. A survey was conducted, and that found that only 1% of men had taken parental leave. This suggested that men weren't taking up the opportunity. But then it transpired that of the men questioned in the survey, only a small proportion of the men had actually had a child recently. Of course, the men who hadn't had a child recently weren't taking parental leave. The survey was absurd, but that didn't stop it from making national news, and it could have gone on to influence government policy. So by looking closely at the primary data, rather than relying on someone else's interpretation, can help to overcome this type of problem.